Dear viewers, I hope you are all fine. This ultrasound video shows a case of missed abortion, also called missed miscarriage, with pregnancy of about 8 weeks. You can see the uterus having a gestation sac and an embryonic pole is visible. This is the embryonic pole. The term early fetal death refers to conditions in which the fetus is no longer alive, but the uterus has not yet started to expel its contents. A variety of terms were used previously to describe this condition, including blighted ovum, missed abortion, and silent miscarriage. Miscarriage is a word used to describe the early loss of pregnancy before 20 weeks of pregnancy. It usually happens in the first trimester. Unfortunately, between 10 and 15% of known pregnancies end in miscarriage. Now, there are three hypothetical causes of fetal demise in first trimester. Number one, Parvovirus fetal infection, primary viral infection of the myocardial cells initially causes myocarditis, leading to hydropic cardiac failure and fetal demise. Second is the bone marrow transit aplasia crisis occurs at the premium movements for anemia, leading to sequences of congestive cardiac failure or hydrops and death, fetal demise. And the third is placentitis without fetal infection causes placental dysfunction and the ultimately fetal demise. Now you can see the uterus having a gestational sac in which an embryonic pole is visible, but no blood flow is seen in the embryo. At the 8 weeks, the fetal cardiac activity and blood flow must be seen, but as in this case, there is no fetal cardiac activity and there is no blood flow, the embryonic demise has occurred. Intrauterine growth retardation has various causes. The most common cause is the problem in the placenta, the tissue that carries food and blood to the baby. Birth defects and genetic disorders can cause intrauterine growth retardation. If the mother has an infection, high blood pressure, is smoking or drinking too much alcohol, or abusing drugs, her baby might have intrauterine growth retardation. Women who retain the dead embryo or fetus can experience several severe blood loss or develop an infection of the womb. There are rare complications also. Some babies die in the uterus, that is womb, before they are born, called intrauterine fetal death. It can happen during the last half of pregnancy or more rarely during the labor and birth, when it is known as intrapartum death, when the baby who has died during labor and birth is born. This is called stillbirth. Although a variety of terms are used to describe this early pregnancy failure, the presence of clear-cut sonographic evidence that a non-living embryo is present, the term embryonic demise should apply. Ultrasound diagnosis of miscarriage should only be considered when either a mean gestation sac diameter is equal to or more than 25 mm with no obvious yolk sac, or a fetal pole with a crown rump length of equal to or more than 7 millimeter without evidence of fetal cardiac activity. Transvaginal ultrasound is the mainstay in the diagnosis of miscarriage. A missed abortion is a non-viable intrauterine pregnancy that has been retained within the uterus without spontaneous abortion. Typically, no symptoms exist besides amenorrhea, and the patient finds out that pregnancy stopped developing earlier when a fetal heartbeat is not observed or heard at the appropriate time. An ultrasound usually confirms the diagnosis. In addition to the signs of fetal life on sonography, subchorionic bleeding is an important factor affecting the outcome of gestations in patients with clinical threatened abortion. The most common cause for the first trimester spontaneous abortion is fetal chromosomal abnormalities. While most practitioners wait until at least 6 weeks to perform the first ultrasound, a gestation sac can be seen as early as 4.5 weeks after the last period. A heartbeat can be detected as early as 5 to 6 weeks, though it might not be detected that early in all cases. A missed miscarriage is a missed abortion in which fetal didn't form or fetal demise had occurred, but the placenta and embryonic tissues are still in the uterus. It is known more commonly as missed miscarriage. It is also sometimes called silent miscarriage. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.